I'm a holistic periodontal and implant specialist. Today, what I'd like to talk to you about is a real important topic, is vitamin D and K2. Why I care about this is I deal with people's bone and their healing. So if I'm doing an extraction or a dental implant, I want that to heal as best as it can. So their levels of D are low, they're usually not going to mineralize the bone after I extract the tooth, or when I put an implant in, it won't heal properly. Vitamin D is a test that you can get at your doctor. A lot of doctors don't do it regularly because it's usually not covered by insurance. I would recommend make sure that when you get a physical, get your vitamin D levels checked, because it's real important, not only for if you're having dental surgery, but also even for your bone health. I like to see levels of 50 and above. For K2, you can't check that level with a blood test, so you just have to eat the right foods and supplement for that. The active form of vitamin D is vitamin D3, so that's what you want to supplement with. For myself, I like to supplement with a liquid and I put it under my tongue. The reason for that is there are blood vessels under your tongue that will absorb the vitamin D3 and the K2, have it combined in one liquid, so that doesn't have to go through your gut. A lot of patients that I see, they'll have a low vitamin D level and they won't really get into their body. They'll do a test a few months after the first test, and even after supplementing, their vitamin D is not going up. There's a few ways to help it go up. Sunlight is one of the ways. What I would recommend is in the early time of the day or the late time of the day when the UV index is lower, expose your body to sun. Let's say you're in more of a northern exposure or it's winter time, you might have to just rely on supplementation or foods that are rich in vitamin D. What are the mechanisms? Vitamin D helps the calcium get from your gut into your bloodstream, and K2 helps your calcium, phosphorus to get out of the blood vessels and then into your either bone or your teeth. It's real important to have these at a sufficient level for proper healing. And even through COVID, we found out that vitamin D was one of the things that could help you not be susceptible or not as susceptible to the virus. Vitamin D is not just important for, let's say you're having dental surgery, but it's for your immune health and also for preventing osteoporosis and helping you to grow old in a way where you keep your bones strong and healthy. Hopefully this was helpful. So if it was, please press a like to this video. I'll look forward to bringing you more information. Thank you so much for watching.